Being diagnosed with prostate cancer in Tennessee, you've got more treatment options than ever before. There's Vanderbilt, Baptist Memorial, as well as a number of radiation oncologists who offer convenient alternatives to surgery. But what's more important, convenience or cure? After all, you don't just want to be treated for prostate cancer, you want to be cured. So how do you know which physicians and treatment methods provide the highest probability of cure? That's what I wanted to know when I was diagnosed back in 2007. I'll never forget hearing the news from my urologist. I was shocked, anxious, and scared. After doing a lot of research and speaking with my wife, I knew I wanted to get treated. But what I learned was there's a huge difference between being treated and being cured. And during my research, none of my doctors really talked about a cure other than in general terms. And these doctors were from some of the most renowned cancer centers in the country. It wasn't until I learned about Dr. Frank Critz that for the first time I heard about and understood the difference between treatment and cure. It was that conversation combined with the cure rate data he had compiled over 14,000 men in 20 years that led me to choose ProstRcision, which you'll learn more about shortly. I sat down with Dr. Critz recently and interviewed him on behalf of the many men I now have the privilege of serving in my role as patient navigator here at Radiotherapy Clinics of Georgia. I asked Dr. Critz to talk about the difference between treatment and cure, and here's what he had to say. In your questions and answers on curing prostate cancer, the guide, it seems that you make a clear distinction between treating prostate cancer and curing prostate cancer. I think you mentioned a little about that just previously. Would you explain what you mean by that?
Well, there's a world of difference between the two statements, treating prostate cancer and curing prostate cancer. For example, there are about a dozen different ways that prostate cancer can be treated for men. There is radical prostatectomy, cutting the prostate gland out. There's a method that we've developed, ProstRcision, seed implants followed by beam radiation. There's seeds only, there's cryosurgery, freezing the prostate gland, proton beam, et cetera, et cetera. The question is, how well do those things work? How well do they cure cancer? Because you don't want to be treated for prostate cancer. If you're diagnosed with it, what you want to do is get rid of it, be cured of it. And a lot of these treatments, let me tell you, don't work very well. They don't get your PSA below 0.2 very well at all. In fact, of the three ways to manage prostate cancer, the only ones that I really recommend is radical prostatectomy by a highly skilled urologist, our treatment program, ProstRcision, or watchful waiting. I don't recommend the others because we don't have data on them.
The physicians at RCOG can offer second opinions and cure rate probability projections to men who have recently been diagnosed with prostate cancer. I recommend as a first step requesting our free guide, Questions and Answers about Curing Prostate Cancer. Complete the form on this page or call us and I'll mail you the guide as well as this DVD right away. I'll also send you a link to my full interview with Dr. Critz, which I think you'll find to be both interesting and helpful. After reading the guide, if I can answer any questions or assist you in getting a second opinion from a physician here at RCOG, give me a call. And be encouraged. Prostate cancer can be cured. The key is to educate yourself, do as much research as you can, and get multiple opinions from doctors who have great reputations. I wish you the best in this journey.